random, or 2 weeks ago, a random issue. But this has happened back to back to back.
Right.
And, you know, Charles and I, we're doing programs together all the time.
All throughout the week. And this never happens.
This does not happen.
It seems to happen every time that we try to do this topic. So how important do you think taking care of our bodies is? While we're working on bringing Dr. Reynolds back so that you can hear the information, I want people to list their questions and see if we can't review some of these questions to make sure that she gets some of these questions that you might have, questions that came up in your mind since you've heard the first it's been 3 presentations, I think. 3 presentations. What questions have come up for you? We want to share about an experience that we've been going through, and just to say how God's the way that he wants us to take care of our bodies, even when you have a sickness and disease, that following God's plan can really be beneficial. So we want to share what we've been experiencing with a close family member.
Yeah. So my father has been visiting with us. He's been here for
almost a week. Tomorrow.
Almost a week. And he suffers from diabetes. Type 2 diabetes. And it's been pretty bad. His balance is off. He has lost a lot of weight. So my dad is like 5.
I don't know his exact
He's like 5'6" or 5'7", probably 5'6". And when he got here, he was 113 pounds with clothes on.
Right, and his blood sugar
stays like
it was 490 when he came.
So it really spikes, 300, 400, sometimes 500. And high blood pressure. So just a lot of stuff going on. And, you know, I was like, Dad, you need to come out here so you can have some time for me to work on you. Now, I am not Weimar.
No, and he's not. He's not a doctor.
I'm not a doctor.
So just some lifestyle changes we were trying to help him with.
Yeah. So when he came out here, he was, you know, it was very difficult for him to walk. And what we have been doing over the last 5 days, if you look into my face, you might see that I'm tired. It is because I have been working with my dad like around the clock.
Literally.
And no stress, because, you know, that's my dad. So we've been working around the clock. You know, I'm giving him his insulin. But at the same time, we've been making some lifestyle changes. So I've had him on a rainbow diet, giving him a lot of foods that are high in fats. So like macadamia nuts, avocado toast. He has that like every morning. First day that he was here, we went on a walk, and he probably could walk maybe 5 minutes, and then he had to come in. The last 3 or 4 days, we've been walking 1 mile to 1.5 miles. His balance has been getting better. I mean, it's improved, I think, dramatically. So I've also had him in the gym, because I have a gym in my house, right? And I'm like, Dad, we are going to start lifting weights. And so he's been lifting weights, doing a lot of squats, you know, with light weights, but working him like a drill sergeant.
Yeah, he's been. I always tell him, like, let him rest. But he lets him rest, but he has a schedule and everything.
So we've been doing water. We've been doing I've been giving him beet juice and garlic for his high blood pressure. And it's just amazing to see how the body responds.
Yeah, you can see the weight gain that he's picked up in the last 5 days and just the life in his face. Like, it's just, he looks different. And also being in sunshine for at least 20 to 30 minutes a day.
So
like
he gets up in the
sunbathing.
morning and he's out in the sun, you know, shirt off,
Yeah,
getting vitamin D. And
we're in California, we can do that.
Yeah. So
well, this time of year, a lot of people can do that.
His blood sugar has been going down over the last 5 days. So it started hovering around 300 and then started going down to 200. And I'm going to share an experience with you that really, really shook me up.
Okay.
It's, you know, I got to share it because, so basically it was his first time in the gym, and I just taken his blood sugar in our home. I just taken his blood sugar, and it was like, I think it was like 400 and something, high threes. And I was like, all right, Dad, come on, we're gonna work out. So we did a lower body workout, right? Squats.
Not too intense, but just
pretty intense.
Okay.
So yeah, pretty intense. And throughout the workout, he was like, you know, I'm feeling better. I'm feeling good. And because at first he didn't really want to do it. So after the workout, and we worked out probably for about 45 minutes.
Right.
And after the workout, I was like, Dad, go ahead and you know, rest. I gave him something to eat. And then I gave him his insulin shot. So he was laying down, sleeping for like 5 or 10 minutes.
Right.
And then I went to check on him, and his words were slurring. And my dad has had a stroke before. So his words were slurring, and he was like, I was like, Dad, he wasn't making sense what he was saying.
Right.
And I called Atante. I was like, Atante, we need to take him to the emergency room right now. He's not making sense. So we get in the car, and I'm driving to the ER, and he's getting worse in the car. Right? Like, he's not making any sense. His face is beginning to droop. So I pull the car over and I call 911, and we end up in a Walmart parking lot. They were like, just wait there. So they come.
The paramedics were there very quickly.
Paramedics got there very quickly, and they asked me what was going on, and I told them he's diabetic. And then I told them that I had him working out. So they said, we're going to take his blood sugar. They took his blood sugar.
Just to rule out that it wasn't like a stroke.
Yeah, just to rule out that it wasn't a stroke. His blood sugar was at 49.
42, I thought.
42. 42. And he said, whatever you're doing, it is working. But you had to give him peanut butter to keep his blood sugar
something like
up.
Peanut butter.
Yeah, something like peanut butter after he worked out to keep his blood sugar up. And it was like in that moment that, and they had to give him sugar. So they put an IV in him and gave him sugar. That's never happened before. Like giving him sugar to get his blood, because it's always high, right? He's always trying to get it down. And so after that whole episode was done, I was like, Dad, like, you see how effective exercise is. Like, it worked better than your insulin has been working.
Right.
And that was just a real eye opener for me. Right. You know, you hear of people like reversing diabetes or getting off of their meds in, 2 weeks of just doing exercising, walking, exercising, diet. And so we've been taking his blood sugar now, and it has been consistently in the mid to low 100s. And every time I show my dad, I'm like, Dad, you want to see the number? And he looks at it and he's like, wow. Because for the last, I don't know, 5 years or more, he's just been used to 300, high twos, 300, 400.
Right. It's just
500.
Yeah, at times it hasn't been good. So we've seen, and again, we're not medical professionals. We're just his children trying to help him. And he does see doctors, of course. But we're just trying to help him with some lifestyle things at home, because he lives basically alone. He wasn't able to do all of these things that, or he hadn't been, I should say, doing these things that we knew could help him. And so just going along, because we are talking about health and nutrition and the benefits and what this can and how it helps with diseases, as we've been talking to Dr. Reynolds, we can just see how much this really helps. So we just wanted to share that story.
He was like, you need to open up a clinic. I was like, God. Yeah. I'm not that skilled in this, but I was sharing with him, being able to see results like this. I was like, Dad, your testimony just in this last week, from not being able to walk for 5 minutes to being able to walk 1.5 miles, and by the way, so one of the things I'd actually called Charles and his wife and asked them, hey, my dad has high blood pressure. What are some of the things you suggest? And they were like, beet juice and garlic.
Yeah, people are talking about beet juice in the chat.
Yeah. And remember how I don't like beet juice. I repent.
Well, yeah.
I repent.
Beet juice or beets, really.
I love beet juice.
I can eat beets, but beet juice.
I don't like how it tastes, but I love what it does. Right?
Right.
So I've been giving my father beet juice, and then I'll take his blood pressure, an hour or two after the beet juice and garlic, and it just drops dramatically. So, there are these different.
Because he's also on high blood pressure medication.
Yeah. So there are just different things that can be done that I think are very effective, very powerful things that the average person
God has given us.
Yeah. Average person just doesn't know. And I think there are a lot of people that are suffering really just out of lack of understanding, lack of knowledge. And, they could be doing a whole lot better. And really, guys, it's like one of the best things you could try to do is just try to educate yourself, right? So someone is asking how much garlic, and honestly, I just went out and got, it's called garlic. You can get it from Walmart. It's a garlic pill, right? And so we use the beet powder. You can buy beet powder. I got the garlic pill. And so every morning I give him the garlic pill, the beet juice powder, and, I'll take his blood pressure within an hour or two to see. It really is amazing to see the cause and effect. To take his blood sugar before he works out, and then to take it after he works out, and to see just how much. And this is what I explained, right? When he's working out, and a lot of times, when you're lifting weights, you're actually burning sugar. Like that's what's happening. Your body is using sugar as a fuel source, right? So he's lifting weights, and I'm like, Dad, I want you to feel the burn when you're curling, right? Feel the burn. And I tell him, look, when you feel that burn, imagine the sugar being burnt up in your body, being used up. And as he is
pushing the insulin into your cells,
exactly,
because it was having a hard time doing that.
And as he's doing this, we take his blood sugar after, and he just looks at it, and he looks at me, and he's like, wow, wow. So, moral of the story: exercise, right? Get your water in.
Eat your rainbows.
Eat your rainbows. So he was 113 when he came. He's 119. He was 119 the last time I weighed him, which was yesterday. And that is without clothes, 119.
Right.
So, I praise God for giving us these remedies, right? And giving us a message that is designed to help us, be on top of our health.
And we're not saying that medication is not needed. Medication is needed at times. It's needed. I'll just put it there. It's needed. But God definitely has a natural plan that can assist medication, or at times completely eradicate the need for some medication. But
so, I mean, just to speak on that for a second, like last night, his blood sugar was so normal that we didn't give him the insulin that we usually give him
at night, because it would have
dropped
too low.
Too low. So this is how people eventually work their way off of insulin, I'm seeing, right? By keeping their blood sugar in a good place through exercise, diet, water, etc. So anyway, just
and being consistent is so important, right?
Yeah.
So it's not just like, one day you can exercise and one day you eat right, or one day you drink enough water. It's really especially with diabetes, right? It's definitely the consistency, because as soon as you get your blood sugar where it is, if you're not consistent, it'll go right back to where you don't want it to be. So consistently. And I think spiritually, we can just learn a lot from how we have to take care of our body, our physical bodies. We have to take care of our spiritual bodies. In that same way, we have to be consistent in giving it the things that it needs. Just really that time with God, talking to God, reading his word, just allowing the Holy Spirit to work in our lives. This is a consistent thing. And as we consistently allow God to do that, we're going in the direction that we want to go for ourselves and where God wants us to go as well. And if we're not consistent, we'll go the other direction. And our blood sugar, our spiritual blood sugar, will be in a place where we don't want it to be.
Yeah. I think there are people that are watching right now that probably dealing with different diseases. One of the things, I think the most important thing I could say to you is try to take charge of your health, right? Try to take charge of your health. I think sometimes people get to the place where they just kind of give up hope. And maybe you need to, if you have a family member like that, maybe you need to be that individual that helps a person who is, giving up hope or feeling hopeless, but don't give up. Fight. That's so crucial. So the doctors, it's interesting, and I'm probably not gonna say much on this, but it's interesting the things that science is discovering regarding the power of the mind, of the brain. And y'all know, Ellen White's statement. She says 9/10 of all diseases begin in the mind, and science is actually bearing that out in a really powerful way. So
I'm seeing Dr. Reynolds' picture. Can you hear us? Can we hear you? All right, you hear us. Can we hear you?
Can you hear me?
We can hear you. I'm hoping that with the audience, just let us know if there's an echo or not. I feel horrible, but we're going to have you recap what you started, because so many people were not hearing it.
And we're just going to take some more time. So,
right.
You go ahead.
Yeah, people are saying it's better, no echo. So go for it.
Perfect. So what I was talking about for the third time, sorry, eating bowls. I was talking about a method for increasing phytonutrient density and diversity in a diet. And I suggested a concept called eating bowls, something that I coined from Genesis 1:29, the original diet for man. And it's essentially a plate or a bowl, and you put a bed of greens, your legumes, you're layering your plate, and full of color. And I actually gave a download for that to walk people through, because I know a lot of people may want recipes, but I think the most important thing is to have a concept of how to make a plant-based dish.
Right. And I think, and you're saying people are going to be able to see this where, like you said,
in a virtual gift bag. There's a virtual gift bag.
Is everyone who's watching going to get this virtual gift bag, or those who are signed up for Power of the Lamb type of subscription. Well, go ahead.
It's going to be made available. He's going to put the link in.
Okay, perfect. Okay, go ahead.
By the end of the talk. Okay. So yeah, it's in that bag. I think what will help people is just getting a concept of how to make a plant-based dish to be nutrient dense.
Right.
And something else, I made my lovely Heavenly Bliss smoothie that we talked about last week. And isn't it so beautiful? Look at the richness of color here.
It is pretty.
Is that the
one with cilantro in it?
This, you know what? The recipe does call for cilantro.
Right.
In fact, that's also this recipe is also in the virtual gift bag. But you know, you guys asked me, what do I eat? And this is what I eat. This is red cabbage. The recipe is in it. I'm not going to spend time going through the recipe, but I don't have cilantro in this one, but you can put cilantro in it.
Okay.
But look at, Saints, look at the beautiful color this is, okay? This is phytonutrient density and diversity, the color, the polyphenols, the bioactive compounds that I talked about that help to, you know, modulate the immune system and have antioxidant properties and lowering oxidative stress and cell injury. This is it.
Wow.
So I drink that, and I eat the eat-in bowls. And some people in my close circle try to eat-in bowls, and they love it. So I shared that with you guys, as well as the recipe for Heavenly Bliss. And check it out. And then since we're on this topic of downloads, I also put inside the virtual gift bag 8 laws, as Charles would say, 8 laws of health on steroids. and essentially what it is it's walking you through, because you guys, this is not the platform to really talk extensively on the topic. There's just so much I have to share with you all. And so there were things that we didn't discuss that play a very important role in health. And I didn't get to everything. So it's in that document on 8 laws of health. And what's really important is that it walks people through the beginner, intermediate, and advanced stages of health. So there are things that we may not have necessarily considered being a part of God's law, but it's an advanced application of God's law. And for example, when we talk about oxygen and deep breathing and air being a doctor of health, we typically think, you know, oxygen, but we're not thinking about the other applications of how oxygen can be used. And so I go through other applications of how oxygen can be used, such as high dose vitamin C, or intravenous therapy, or ozone therapy. These are oxidative therapies that help to force oxygen into the cells, and they reduce oxidative stress and cell injury. So this is other applications that are used in production of oxygen in the body that we don't really talk about much. So look through the document. It's in the virtual gift bag, and you guys have that. I also talk about sleep, the roles of melatonin and how it's antioxidative. In fact, there are over 8 clinical trials right now being studied for the use of melatonin in COVID-19 because of its antioxidative properties. And it's also being used, 20 milligrams of melatonin has been used for ovarian and breast cancers and prostate cancers as well. So melatonin, our sleep hormone, that usually comes, you know, it's synthesized and produced and released during the evening after cortisol levels go down, ideally. And so we see the role that hormones that usually are upregulated in the evening play on the immune system. So go through that document. It's available. And since we're talking about melatonin, I'm actually going to go into supplementation, because I heard briefly the pastor talking about some supplements. And I think, before I go on, are there any questions about what I just said?
Well, I had a question about, so when you're saying melatonin, so you're just saying the melatonin, because our body naturally produces melatonin, right? But then we can take supplements that have melatonin in it, and that actually is healthy for us. Because I think some people are afraid of even those type of things, but you're saying it's healthy for us.
Yeah. So I haven't seen in the studies, and I know that my husband and I, this is an example, we talked about that topic of, is supplemental melatonin, what are long-term effects of melatonin supplementation? Will that have any impact on endogenous production of melatonin? And I haven't seen in the studies that melatonin supplementation would, well, let me give some backdrop. Theoretically, if you're supplementing with any hormonal replacement, the thought is that you would essentially train the body not to produce its own melatonin, and that's a concern. But I haven't seen it. I haven't seen in the studies that that's a concern. The other issue that oftentimes comes up is long-term use of melatonin at high doses. So typically when you're taking melatonin for sleep to help you fall asleep or stay asleep, there are two types of melatonin: time release or extended release or sustained release. But depending on what kind of sleep issue you have, if you can't fall asleep, you take a different type of melatonin versus if you have a problem staying asleep. Whatever the situation is for you, you take melatonin typically around 6 milligrams is the standard dose. Between 3 and 6 to 20 milligrams. And they've been on 20 milligrams for a very long time with no side effects. There aren't any long-term, as I haven't seen, long-term use of melatonin, nothing like that. So I would also recommend taking it as needed. If you're not a cancer patient, you're not working with a provider to use melatonin in the application, it's no need to really take melatonin at that concentration. But in the clinical trials that are happening for COVID-19, patients are some of the patients are taking 70 milligrams because melatonin is very, very a potent antioxidant. But what I also want to mention too is that the point is not so much to take melatonin. The point is to optimize sleep and to help your body naturally produce melatonin. What happens is most people, we live in a busy world, and we're constantly, we have artificial lights that we're subjected to. And at night, let me just mention this. So at night, when you're going to sleep, cortisol is supposed to be low. And so there should be this indirect relationship of cortisol and melatonin. Cortisol at night, if it's too high, it affects melatonin production and release. And there are reasons why cortisol is high in the evening. But before I go there, the natural diurnal rhythm and circadian rhythm of cortisol is that it's high in the morning, and then it gradually tapers down as we go through the evening. And the reason being is that cortisol is supposed to be high in the morning so that you can get your morning started. You need the energy to get going. Some people wake up sluggish, and sluggishness in the morning could be due to a number of underlying etiologies such as thyroid issues, or there could be chronic fatigue syndrome, some kind of underlying condition that would cause a person to not have that energy in the morning that cortisol typically produces. But as you go down to sleep, when you're going, supposed to sleep in the evening, the natural circadian rhythm of cortisol is that it's supposed to go down at night. But what's happening is we have these things called the cell phone. And so, you have your computers or you have your televisions. And so what happens is the artificial light that comes in, it hits the optic nerve and it affects the production of melatonin from the pineal gland. And what happens is you start to have this hypothalamus pituitary adrenal activation and a release of cortisol. So your adrenals are these glands that sit at the superior poles of your kidneys in the back, and they get feedback from the pituitary gland. And what happens is when you have artificial light coming in, it's actually stimulating the release of cortisol. It increases cortisol. And then you wonder why you can't fall asleep at night. It's because your natural circadian rhythm is being affected. Artificial light and not enough of natural light affects the circadian rhythm. And so you start to have issues with sleep and cortisol being elevated at times that it's not typically supposed to be. And then melatonin doesn't get released. So you have to really turn off all of your electronic devices 1 hour before bed so that you can help produce the endogenous melatonin that's required for sleep. Some people do have issues with staying asleep, and that's usually sometimes due to cortisol spiking because their blood sugar go down. When your blood sugar drops, cortisol spikes because cortisol plays a role in gluconeogenesis, or the production of glucose, because you need to sustain blood sugar. So you just have to make sure that and I talk about some of these things in that document on 8 Laws of Health on Steroids. So take a look at it. But essentially you want to have a lifestyle that helps support your natural body's ability to produce melatonin. And so that's what I'll say about melatonin, but it is a supplement. And then I wanted to go into the topic of supplementation because that's such an important.
I have a question about one of the things that you mentioned. So the cortisol, cortisol is supposed to be high in the morning, right? So if somebody does have an underlying issue and it prevents the cortisol from being high in the morning and affects their energy and they feel sluggish, even though they got proper sleep or amount of hours of sleep, but they're still kind of tired. So if someone was going to take a cortisol supplement, and maybe this is going into what you're going to say, is it okay to do that like in the morning to help with energy?
Yeah. For example, there are adaptogens. These are herbs, botanicals that actually help with that energy production. The other thing I can say too, and this is for people who don't necessarily, this is for people in general, but also for people who have that sluggishness in the morning, that can be a sign of low cortisol. That could also be a sign of anemia or some kind of microcytic anemia, like iron deficiency or B12 deficiency and megaloblastic anemia. So you have to first rule out the most common causes of sluggishness, and usually with some of the patients that I've worked with, it's thyroid, either hyper or hypothyroid. But you have to rule that out before you go back to saying as cortisol. But nevertheless, if you are one of those people, adaptogens are herbs that help to boost energy, like rhodiola is a terrific one. Ashwagandha or withania, those are terrific herbs, and even glycyrrhiza. But this is something else I'll mention. The best time if you want to spike your cortisol in the morning, exercise. Exercise in the morning. Always put your exercise in the morning because cortisol spikes with exercise. Okay. You don't want to work out in the evening. I know many people do it because it's perhaps the most convenient time, but cortisol spikes when you exercise. So if you need to go to sleep at night, you don't want to spike your cortisol in the evening. Right. So if you're a person who is sluggish and you need that burst of energy, spike your cortisol levels by exercising. Go do exercise. If you don't have a cardiac condition where you have to exercise to tolerance, or you don't have any other medical condition, do a high intensity interval training routine. Spike your cortisol in the morning.
Hot and cold showers.
Oh, I love them.
Do they spike cortisol?
That is amazing. So that.
No, you're not allowed to freeze right now.
Actually, I brought that up, and hours are amazing. In fact, you could do that too. I did that when I was studying for my medical licensing exam. I woke up in the morning. My exam was it was a 5 or 8 hour exam for 4 days in a row. And I was so burnt out and tired. And I woke up at 4 in the morning and did hot and cold showers. They're amazing. They boost energy. They cause the vasoconstriction, dilation of your arteries, your superficial vessels, as well as the lymphatic vessels. And so that burst, that constant, like going back and forth like this, with your vessels, increase circulation. And if the more circulation you can increase, the more energy you will have, because you're increasing oxygen to your cells. Okay, and inside your cells, you have an organelle called the mitochondria. And the mitochondria are the energy producing cells, or organelles of the cell. So they help to produce that the energy that you need. And so contrast showers are superior hydrotherapy treatment that you could use to boost energy. And that's something that I also recommend for people who have, any kind of musculoskeletal pain, joint pain. It's amazing. And so that's another option if you're not into working out, doing a high intensity interval routine in the morning. You could do simply hot and cold showers. They're amazing. Yeah.
I want to ask a question for one of the people watching. Goodness, where did it go? They want to know about CMOS. Are you familiar with CMOS and its benefits and what it helps with? Are you familiar with that? Okay.
Yeah. Yeah. So CMOS, there are different types of CMOSs. They come in various colors. They're very, very beneficial. Depending on the colors, you get different types of polyphenols and vitamins and minerals inside CMOSs. But the only thing that I would say is that you have to source them very carefully, like you would spirulina or chlorella, because they are they absorb toxins and heavy metals. So you just make sure that you, which actually goes into my talk about supplements, because that's a really, really important area that there needs to be more education around that. But essentially, you need to source the CMOS from a reputable company, because there's an issue with contamination, and because these sea plants can absorb heavy metals and other toxins from the water sources. And just to segue, that's a really important area, supplementation, and being knowledgeable how to source your supplements. I get a lot of questions from people about, is this supplement okay to take? So I want to mention this. Remember, guys, supplements are supplements, meaning that you are to already be getting these nutrients from your diet. Okay, right. They're intended to supplement something that you're already getting in a diet. That is first and foremost. You cannot out supplement a nutrient dense diet. You need to always eat a nutrient dense diet to get your nutrients. Okay. And secondly, there needs to be more education around how to look for the correct bioavailable forms of your nutrients. Sometimes I've had patients show me, hey, doc, what do you think about this supplement? And it's a vitamin. And I look at the supplement and they're oxide form, zinc oxide, magnesium oxide. No. You don't want oxide, because when you take in vitamins, your body metabolizes it to an oxide form. Oxide is eliminated through the bowels. If you want to have a bowel movement and you're constipated, sure, take magnesium oxide, it'll make you go have a bowel movement. But if you're actually taking it to absorb, to utilize the benefits of magnesium, you don't want anything in oxide form. The other thing is the B vitamins. A lot of times people are taking cyanocobalamin, for example. You need to look for the appropriate bioavailable forms of your vitamins. Methylcobalamin, methylfolate. And the reason why is because you're going to take these vitamins. Some people have what are called single nucleotide polymorphisms that affect the way their bodies metabolize vitamins. And for example, if you're a person who has an MTHFR mutation, okay, and let me see if I can remember back. MTHFR, methylene tetrahydrofolate reductase. That
sounds simple.
MTH, I'm just used to the mnemonics, but I have to break it down for a second. So basically, that's an enzyme that's coded by the MTHFR gene. And some people have variants of that gene that affects the way their bodies metabolize B vitamins. So a lot of times when you're taking, and over 50% of the population have an MTHFR mutation. So I don't sometimes know if people have it or not, and sometimes people don't know unless they test. So they go and make sure that your B vitamins are in methyl form, just to take care of that. And a simple way to know if you likely or possibly have an MTHFR mutation is to run a homocysteine. Homocysteine is an amino acid that is a product of protein metabolism. And when homocysteine is high, that can indicate that you have that mutation, because as you're taking in your B vitamins, it's going through a process called methylation. And methylation happens in every cell, and it's a very important role. It plays a very important role in the liver in particular. In your liver, everyone knows the liver detoxifies, okay? Your liver undergoes biotransformation by 2 phases, phase 1, phase 2. Phase 1, you have your cytochrome P450 enzyme systems, a set of enzymes that are responsible for breaking down lipid or fat soluble toxins and make them into more soluble, make them more water soluble so you can excrete them. But once that toxin moved from phase 1 into phase 2, there's several processes of phase 2 liver detoxification, and one of them is methylation. And some people have specific genetic variants of that gene that affects methylation. And so because people have it, you have to make sure that your vitamins they're methylated. And then the other thing is, you should speak with make sure you work with your doctor in sourcing the correct supplement, because a lot of times, supplement companies make so much money, and you have to know where your supplements are coming from. Does the company practice, do they believe in transparency? Is that something they value? You should be able to contact the manufacturer and ask them, hey, can I have a copy of the certificate of analysis of your product? Because that certificate will show you that they got their product tested by a third-party lab, and this lab will be testing for mycotoxins, which are fungal spores that can contaminate the product. The laboratory will be testing for yield. During the extraction process of the supplement, did they start out and end with the amount that they started out in is the final yield, what you're going to actually get, what they started out with. So you want to.
Can I jump in there really quick? So yeah, everyone, including myself, we love all this information. Some people are saying, is there anything supplement that you take that makes your memory so good? Because they're like, how do you remember all this? And the way you're rattling it off. But I want to like slow it down a little bit and take it back, because we have some good questions that people want to know, right? And I'm sorry to interrupt you where you are, but I think the one is on the screen, like, and you probably said this a while back now, but what does the NTFR mean or represent? You covered that. Okay, go ahead.
So I'm going to break it down again. Okay. So MTHFR.
To like a fifth grader, or like, no, a five-year-old to like a 5-year-old. You're explaining it to like your kids. Okay, go ahead.
Okay, so it's a gene that controls a process in the body called methylation.
Okay.
This is a process that happens in all of your cells,
right.
Okay? And it regulates hormone metabolism, protein metabolism, basically metabolism meaning it plays a role in breaking down your proteins, breaking down your hormones. It plays a role in breaking down neurotransmitters. So people who have this mutation, it's been shown that, if you have hormone sensitive conditions such as breast cancer or prostate cancer or uterine ovarian cancer, it affects all of that. It also affects your neurotransmitters. So we're also seeing that the mutations affect people, can increase the risk for depression. And so it plays a huge role in a lot of biochemical processes in the body. And so when that pathway of methylation is affected, it's going to affect how your body metabolizes these neurotransmitters or proteins or your hormones. And so that's what that is. And it's a complicated process that happens in a cell, and we're seeing that it's connected to a lot of things. And I actually got tested for that as well. And you can go to your doctor and have them check you for that mutation if you're interested in genetics like that.
And then, but if you have, let's just say you come back positive with that, then what does a person do? So
if that's the case, then what you do is you work with your practitioner to help shunt methylation. And because some people, it's really complicated, but some people, it's really complicated in a sense that I don't want to make you guys even more complicated by going into all of what's happening in a cell. But essentially, you have a set of enzymes that are playing a role in methylation in the body, inside your cell. And sometimes there are mutations that are happening where these enzymes aren't able to take this substrate, convert it to the next substrate, and downstream processing. Something happens. And it's because either they have mutations in the enzymes that are responsible for the conversion of some of these vitamins. And so when that happens, you have to give the body a little bit more support. And that the support that I was talking about, for example, was methylated B vitamins. You get a supplement, you work with your provider and have them put you on a supplement that supports methylation inside the cell. And it's very easy. Just look at your B vitamins and look for the methyl version of it. A lot of quality companies are putting more of their the methyl groups on their B vitamins because a lot of people do have the mutation and don't know it. But it's more complicated than that. Sometimes you have to supplement with other types of cofactors because in that methylation cycle, homocysteine metabolism, you start to have other enzymes that require other cofactors such as zinc and magnesium. So that brings me to another important point. if you are deficient in one nutrient, you're likely deficient in many others. So you have to, you know, keep that in mind because they work synergistically. And, you know, for example, if you're deficient in zinc, that can affect copper levels. If you're deficient in magnesium, yes, it will affect vitamin D. Yes.
I was just going to say, I don't think the information you're sharing is too complicated in the sense in my brain, it's like the way we eat and the supplements we take, we're basically trying to, or everything we do for our bodies, right? Because a couple of episodes ago, we talked about having happy cells. So you said there's a lot that's going on in each cell that makes it be functional and work properly. So we may not understand every aspect of that right now, or maybe ever, but the point is that whatever we're doing, we want to make sure whatever we're putting into our body is going to help that cell be a happy cell. Because when you have millions and millions of happy cells, then you have a healthy body. And that's for the 5-year-old myself.
That's absolutely true, Atante. That's essentially the point. But I also want to mention that it's really important to, you know, given the fact that 84% of primary care visits involve drug treatment, and knowing that there's drug-induced nutrient depletions, it's even more imperative that people take their, work with their provider and getting on a regimen that will actually mitigate the effects of the depletions, because at a fundamental level and at a cellular and biochemical level, we know that these nutrients play a very vital role in physiology. And so I wanted to give you guys a list of nutrients that I have used clinically and I've used personally to help you guys. If you get sick, I know that's often a question that I get. A lot of people ask me, what do I recommend for, helping build the resilience of the immune system? And so we talked briefly, I'm gonna go through this rather quickly. Vitamin D, we talked about. Make sure you get your vitamin D status checked. Vitamin D, if you have vitamin D insufficiency or deficiency, make sure you correct that, work with your practitioner. Some other point, very, very nuanced point, vitamin D bioavailability can be impacted by body composition. So if you have increased abdominal adiposity, you can affect how vitamin D is being absorbed by your cells. If there's increased adipose tissue is fat cells, your vitamin D is fat soluble, it will suck up everything. So sometimes people who have abdominal adiposity, they usually require higher levels of vitamin D. So just work with your practitioner and get that corrected, just to get the appropriate vitamin D dosage for you. Next nutrient, vitamin C. Vitamin C, we talked about how it concentrates in your white blood cells. Your white blood cells and your adrenals have the highest concentration of vitamin C. Over 45% of the population has vitamin C deficiency. So make sure you replenish vitamin C and the heavenly bliss. And just make sure that if you are taking it, here's a supplement that I take. I can recommend it. It's called buffered vitamin C. I don't know if you guys can see that, but okay. If you guys interested in this particular supplement, anyways, it's a powdered buffered vitamin C, and it in one scoop you get 2,000 milligrams. I usually, for acute infection, I usually use 1,000 milligrams 3 times daily, or bow to tolerance, which basically means that you take vitamin C high, you keep taking it until you reach the point where you see loose stool. When you see loose stool, you taper down. And that's the amount of vitamin C that your digestive tract can tolerate. And so for acute infection, 3,000 milligrams is what I use. And the other note is that when you're under stress or you're fighting infection, the body requires more nutrients. So you're going to burn through a lot of these nutrients. So you need to constantly replenish them. Vitamin C is water soluble. So you're constantly getting rid of vitamin C. So you need to constantly replenish it. Next important nutrient.
Quick question. What do you do if your brain hurts after hearing a presentation? Are there any supplements or nutrients for that?
By the way, guys, this information, I studied for 5 years.
Right.
Okay. So keep that in mind. I studied advanced science for five years. I'm nothing special. But I'm passionate about it. And it's because God has, I feel like he's called me to give this information. I love disseminating it to people because I know that the Lord is powerful and he's constantly working to help bring people closer to him. And he does it with nature. And I'm so into biochemistry, nutritional biochemistry, and cell physiology, and which is one reason why I became a naturopath, because we really study deeply, because we work on the inside out. We have to work with, like, heal the body, and not now I'm not saying that medication's bad, don't get me wrong, but I'm saying that it is very easy to neglect what's happening inside when you just cover it up with a medication. And so I'm trained to use a root cause model, a systems biology approach, and looking at all of the interconnections of all the systems in the body. And you can't be lazy as a doctor when you do it that way. You cannot. I remember talking to my colleagues one day, and I told them, man, I wish I could give this patient an ACE inhibitor. It would be so much easier if I could just prescribe an ACE inhibitor or diuretic. But I had to work in investigating at the cellular level. What is going on with this patient? What nutrient is required for the conversion of this particular substrate into 5-HTP? So it takes really, thorough investigation as to what's happening inside the cells. And so that's one reason why I became an ND, because we go deep into biochemistry and understand, and just, really taking time and identifying where the perpetuators and mediators of dysfunction are really coming from. And so, so zinc, before I forget, I want to make sure I get to the last nutrients. Zinc, really important. Zinc citrate or piliconate. These are nutrients that zinc is really important for preventing DNA oxidation and DNA stress. You can actually slow aging with zinc. And it, plays a role. Zinc and selenium plays a role.
Everybody's ears just perked up. Slow aging. Go ahead. When you said slow aging with zinc, everybody's ears perked up. Everybody wants to hear that.
It slows the aging process because it prevents DNA oxidation. And so when we have DNA oxidation or any kind of stress to the DNA, it promotes mutations. And mutations, of course, is the onset. It paves the way for cancers, for example. And then it, plays a role in ovarian physiology, reproductive health, and as well as the thyroid. I was able, prayed by God's grace, worked with patients, got them off their thyroid medication simply by understanding the conversion, like these nutrients and their role in thyroid production. And so it's important to get these nutrients in. So zinc, within 48 hours of the onset of symptoms, if you have cold, you want to take 50, I usually go 60 to 100 milligrams within that 48-hour window of onset of symptoms. It's not that zinc won't be effective if you take it after 48 hours, but according to the studies, within that 48-hour window of time, you want to high dose on zinc. But for short term, because it does deplete copper, you do need to have a healthy balance between copper and zinc because they compete for absorption. But just within that 24 to 48 hour window of time, zinc is effective. And then selenium methionine as well. 200 micrograms of selenium methionine was shown to increase natural killer cell activity by 80%. And for those who don't know what natural killer cells are immune cells. They're one of the most potent anti-tumor killing cells of the immune system. You can go and check it out. The natural killer cells play a very important role in the pathogenesis of a lot of cancers. And so activating ability to phagocytose, they're just like your macrophages, the other white blood cells of the immune system. If you support them with these nutrients, they take care of you. They sacrifice themselves for you. So and so we need to take care of them.
Right.
And we do that by giving them these nutrients. And selenium plays a role in the conversion of, active thyroid hormone as well. So I've really literally seen patients' lab work improve, their thyroid function improve simply by adding in zinc and selenium. And you, of course, you take care of the other stuff that's happening, lifestyle, the modifiable lifestyle factors that if, are out of balance, you have to address that. And so, those are the selenium methionine is the form that actually is the most bioavailable. And so I use that, and I use a sublingual version of selenium methionine you can get, and that will help with increase your, women or men are having fertility issues. Zinc and selenium plays a role. I've seen patients' labs where a male's labs and his morphology, sperm morphology is affected. Either the sperm is not swimming properly or just doesn't have the tail, the flagella that helps the sperm move. If there's any deficiencies there, if there's any environmental toxicity, you can have, it will affect ovarian physiology as well as male reproductive health.
So it's helped women with reproductive issues like that have endometriosis and have those kind of things going on. Has it helped in those scenarios?
I'm sorry, I didn't hear you.
No, I heard what you said, how it helped men with reproductive issues. Has it helped women in reproductive situations like that have endometriosis specifically?
Yeah, well, endometriosis is another thing, but in terms of fertility and helping with ovarian function, it does definitely support that. But in terms of endometriosis, that's an estrogen dominance issue. And so if you have uterine fibroids or leiomyomas, or if you have fibrocystic breast tissue, or even breast cancer, sometimes breast cancer isn't always just related to estrogen dominance, but the overstimulation of estrogen to your estrogen receptors in your breast isn't always a good thing. So there's usually something wrong with the way the body is metabolizing estrogen, or it could be that there's exposure to exogenous sources of estrogen, such as the estrogen, the endocrine disruptors that I talked about.